Headache. A headache is a pain in the head or face that can be mild or severe. It can be a symptom of many different medical conditions or injuries. A headache is a pain in your head or face that's often described as a pressure that's throbbing, constant, sharp or dull. Headaches can differ greatly in regard to pain type, severity, location and frequency. Some common causes of headaches include tension, sinus problems, eye strain, and dehydration. Migraines, which are a type of severe headache, can also be caused by a variety of factors, such as changes in brain chemicals, genetics, and environmental triggers. Headaches can be treated with over-the-counter or prescription medications, or with home remedies such as rest, relaxation techniques, and hydration. A chronic headache is a headache that occurs 15 or more days per month for at least 3 months. Chronic headaches can be caused by a variety of factors, including underlying health conditions, lifestyle factors, and medication overuse. Some common types of chronic headaches include tension headaches, migraines, and cluster headaches. Chronic headaches can significantly impact quality of life and may require ongoing treatment to manage. Treatment options may include medications, lifestyle changes, and relaxation techniques. Headaches are a very common problem, and it is estimated that about 47% of adults experience at least one headache per year. The incidence of headache can vary depending on various factors such as age, sex, and geographic location. For example, research has shown that women are more likely to experience headaches than men. And the prevalence of headache tends to increase with age. Headaches can also be more common in certain geographic regions, due to differences in factors such as diet, climate, and environmental exposures. Headaches can cause a variety of symptoms, including pain or discomfort in the head, scalp, or neck, sensitivity to light, sound, or smells, nausea or vomiting, difficulty concentrating, dizziness or lightheadedness, blurred vision, tiredness or fatigue, confusion, changes in mood. Severity. The severity and specific symptoms of a headache can vary greatly depending on the underlying cause. For example, a tension headache may cause a dull, aching sensation, while a migraine headache may cause a severe, throbbing pain. Some types of headaches, such as cluster headaches, can also cause facial pain or swelling, redness in the eye, or a runny or congested nose. Types of headaches. There are more than 150 types of headaches. They fall into two main categories, primary and secondary headaches. Primary headaches. Dysfunction or overactivity of pain-sensitive features in your head cause primary headaches. They're not a symptom of or caused by an underlying medical condition. Some people may have genes that make them more likely to develop primary headaches. Types of primary headaches include 1. Tension-type headaches. 2. Migraine headaches. 3. Cluster headaches. 4. New daily persistent headaches, NDPH. Tension headaches are the most common type of headache and are often caused by muscle tension or stress. Migraines are a type of headache that is often characterized by severe pain, sensitivity to light and sound, and other symptoms such as nausea and vomiting. Cluster headaches are a type of headache that tends to come and go in clusters, and they are often accompanied by symptoms such as eye watering and nasal congestion. Some primary headaches can be triggered by lifestyle factors or situations, including A. Alcohol, particularly red wine. B. Certain foods, such as processed meats that contain nitrates, food-triggered headaches. C. Consuming nicotine, nicotine headache. D. Changes in sleep or lack of sleep. Poor posture. E. Physical activity, such as exercise, exertion headaches. F. Skipped meals, hunger headache. G. Coughing, sneezing, blowing your nose, straining, such as when having a bowel movement. H. Or laughing or crying vigorously, primary cough headaches. Primary headaches typically aren't dangerous, but they can be very painful and disrupt your day-to-day life. 1. Tension headache. A tension headache is a type of headache that is characterized by a feeling of pressure or tightness around the head, scalp, or neck. Tension headaches are the most common type of headache, and they are often described as feeling like a band of tightness or pressure around the head. They can be caused by muscle tension in the neck and scalp, eye strain, or stress. Tension headaches can be mild to moderate in intensity, and they may be accompanied by symptoms such as a dull, aching pain, sensitivity to light or noise, and difficulty concentrating. Treatment for tension headaches may include over-the-counter pain medications, relaxation techniques, and lifestyle changes to reduce stress. 2. Cluster headache. A cluster headache is a type of headache that is characterized by severe pain on one side of the head, often around the eye. It is called a cluster headache because it tends to occur in clusters, with multiple headaches occurring over a period of time, followed by a headache-free period. Cluster headaches are relatively rare, affecting less than 1% of the population. They are more common in men than in women and often begin in people who are in their 20s or 30s. Cluster headaches can be extremely painful and can interfere with daily activities. They are generally treated with medications and/or lifestyle changes. 3. Migraine. A migraine is a type of headache that is often accompanied by other symptoms, such as nausea, vomiting, and sensitivity to light and sound. Migraines can be severe and can last for several hours or even a few days. They are more common in women than in men and tend to run in families. Many people who get migraines have a family history of the condition. There is no cure for migraines, but there are a number of treatments that can help to relieve the symptoms. 4. New daily persistent headaches, NDPH. These may start suddenly and can go on for 3 months or longer. Many people clearly remember the day their pain began. Doctors aren't sure why this type of headache starts. Some people find that it strikes after an infection, flu-like illness, surgery, or stressful event. The pain tends to be moderate, but for some people, it's severe, and it's often hard to treat. Symptoms can vary widely. Some are like tension headaches. Others share symptoms of migraine, such as nausea or sensitivity to light. Call your doctor if your headache won't go away or if it's severe. Secondary headaches. An underlying medical condition causes secondary headaches. They're considered a symptom or sign of a condition. Types of secondary headaches that aren't necessarily dangerous and resolve once the underlying condition is treated include 1. Dehydration headache. 2. Medication overuse headaches. Types of secondary headaches that can be a sign of a serious or potentially life-threatening condition include 3. Spinal headaches. Spinal headaches are intense headaches that occur when spinal fluid leaks out of the membrane covering your spinal cord, usually after a spinal tap. Talk to your doctor if you get a headache after you have a spinal tap, a spinal block, or an epidural. Your doctor might call it a puncture headache because these procedures involve piercing the membrane that surrounds your spinal cord. If spinal fluid leaks through the puncture site, it can cause a headache. Most spinal headaches can be treated at home, but prolonged, untreated spinal headaches can cause life-threatening complications, including subdural hematoma and seizures. 4. Thunderclap headaches. A thunderclap headache is an extremely painful headache that comes on suddenly, like a clap of thunder. This type of headache reaches its most intense pain within 1 minute and lasts at least 5 minutes. People often call this the worst headache of your life. It comes suddenly out of nowhere and peaks quickly. Causes of thunderclap headaches include blood vessel tear, rupture, or blockage, head injury, hemorrhagic stroke from a ruptured blood vessel in your brain, ischemic stroke from a blocked blood vessel in your brain, narrowed blood vessels surrounding the brain, inflamed blood vessels, blood pressure changes in late pregnancy. Take a sudden new headache seriously. It's often the only warning sign you get of a serious problem. They can be a sign of A. Head injury, B. Brain bleed, C. Reversible cerebral vasoconstriction syndrome, D. A sudden, severe rise in blood pressure. 5. Post-traumatic headaches. Post-traumatic stress headaches usually start 2 to 3 days after a head injury. You'll feel a dull ache that gets worse from time to time, vertigo, lightheadedness, trouble concentrating, memory problems, tiring quickly, irritability. Headaches may last for a few months, but if it doesn't get better within a couple of weeks, call your doctor. Less common headaches. 6. Exercise headaches. When you're active, the muscles in your head, neck, and scalp need more blood. Your blood vessels swell to supply them. The result is a pulsing pain on both sides of your head that can last anywhere from 5 minutes to 48 hours. It usually hits while you're active or just afterward, whether the activity is exercise or sex. 7. Hemicrania continua. Hemicrania continua is a chronic, ongoing headache almost always affects the same side of your face and head. Other symptoms include pain that varies in severity, red or teary eyes, runny or stuffy nose, droopy eyelid, contracted iris. Responds to the pain medication indomethacin. Worse pain with physical activity, worse pain with drinking alcohol. Some people also notice migraine symptoms like nausea and vomiting, sensitivity to light and sound. There are 2 types. Chronic, you have daily headaches. Remitting, you have headaches for 6 months. They go away for a period of weeks or months and come back. 8. Hormone headaches. You can get headaches from shifting hormone levels during your periods, pregnancy, and menopause. The hormone changes from birth control pills and hormone replacement therapy can also trigger headaches. When they happen 2 days before your period or in the first 3 days after it starts, they're called menstrual migraines. 9. Rebound headaches. You might also hear these called medication overuse headaches. If you use a prescription or over-the-counter pain reliever more than 2 or 3 times a week, or more than 10 days a month, you're setting yourself up for more pain. When the meds wear off, the pain comes back and you have to take more to stop it. This can cause a dull, constant headache that's often worse in the morning. Rare headaches. 10. Ice pick headaches. These short, stabbing, intense headaches usually only last a few seconds. They might happen a few times a day at most. If you have one, see the doctor. Ice pick headaches can be a condition on their own, or they can be a symptom of something else. Causes of headaches. The pain you feel during a headache comes from a mix of signals between your brain, blood vessels, and nearby nerves. Specific nerves in your blood vessels and head muscles switch on and send pain signals to your brain. But it isn't clear how these signals get turned on in the first place. Headaches may be caused by a number of conditions, such as disorders of the neck, eyes, brain, jaw, teeth. There are many possible causes of headache, including tension, sinus issues, eye strain, and dehydration. Other possible causes include problems with the teeth or jaw, infection, injury, and certain medical conditions such as high blood pressure. In some cases, the cause of a headache may be unknown. If you are experiencing frequent or severe headaches, you should consult with a healthcare provider for a proper diagnosis and treatment. Headaches can be caused by a variety of factors, including muscle tension, sinus issues, eye strain, and changes in brain chemistry. When you have a headache, it's usually because something is affecting the blood vessels, nerves, or muscles in your head or neck. For example, if you have a tension headache, it may be because the muscles in your neck and scalp are tense. Sinus headaches. Sinus headaches are caused by inflammation in the sinuses, which can be due to an infection or allergies. Eye strain can cause headaches because it leads to muscle fatigue in the eyes and surrounding muscles. Changes in brain chemistry can also cause headaches. For example, if you are dehydrated, your brain may temporarily shrink in size, leading to a headache. Hormonal changes, such as those that occur during menstruation, can also cause headaches. There are several ways that stress can cause headaches. One common way is through tension headaches, which are caused by muscle tension in the neck, scalp, and jaw. When you're under stress, your muscles can become tense and contract, leading to a headache. Another way that stress can cause headaches is through changes in your body's production of chemicals called neurotransmitters. These chemicals help transmit messages between nerve cells, and when they are out of balance, it can lead to headaches. Finally, stress can also cause changes in your body's hormone levels, which can also contribute to the development of headaches. Genetic factors can play a role in the development of certain types of headaches, such as migraines. However, there are many other potential causes of headaches as well, including environmental factors, lifestyle habits, and underlying medical conditions. Alcohol can cause a headache. A hangover is a group of symptoms that can occur after drinking too much alcohol. These symptoms can include a headache, feeling tired, feeling sick to your stomach, and feeling dehydrated. The headache is often caused by dehydration and changes in blood flow to the brain that occurs after drinking alcohol. It can also be caused by a change in the levels of chemicals in the brain, such as serotonin and vasopressin, which can be affected by alcohol consumption. Diet can cause headaches in some people. For example, if you skip meals or go a long time without eating, you may get a headache. This is because your body needs a steady supply of nutrients in order to function properly. And not eating enough can cause your blood sugar to drop, leading to a headache. Other dietary factors that can cause headaches include caffeine withdrawal, dehydration, and consuming too much alcohol. Some people also experience headaches as a result of eating certain types of foods, such as those that are high in salt or MSG. If you think that your diet may be causing your headaches, it may be helpful to keep a food diary and see if you can identify any patterns. Side effect. Many drugs can cause headaches as a side effect. Some common types of drugs that can cause headaches include pain medications, such as aspirin, acetaminophen, and ibuprofen, decongestants. Hormonal contraceptives, such as birth control pills, caffeine, alcohol. If you are experiencing headaches after taking a new medication, it is important to speak with your healthcare provider. They will be able to determine if the medication is causing your headaches and, if necessary, recommend an alternative treatment. High blood pressure, also known as hypertension, can cause headaches. When your blood pressure is consistently high, it can put extra strain on your blood vessels, which can cause them to narrow and become inflamed. This can lead to headache pain, particularly in the front and sides of your head. Many other ailments can also cause headaches. Headaches can be caused by a wide variety of factors, including infections, such as the common cold or flu, allergies, sinus problems, eye strain, dehydration, hunger, hormonal changes, such as those that occur during menstruation, stress, tension, sleep deprivation. A headache can be a symptom of a serious underlying condition. Some possible causes of a headache include migraines, tension headaches, sinus headaches, cluster headaches, high blood pressure, infections, such as meningitis or encephalitis, brain tumors, aneurysms. Overall, the specific cause of a headache can vary, but it is usually due to some sort of irritation or inflammation in the head or neck area. Duration of headache. The duration of a headache can vary greatly depending on the type of headache and the underlying cause. Some headaches may only last a few minutes, while others may persist for several days. The severity of a headache can also vary, with some people experiencing mild discomfort and others experiencing severe pain. Diagnosis. There are several ways a headache can be diagnosed. The process usually begins with a thorough medical history and physical examination. Your doctor will ask about your symptoms, including the location, duration, and intensity of your headache, as well as any triggers or factors that make it better or worse. They may also ask about your overall health, medications you are taking, and whether you have a history of headaches or other medical conditions. In addition to the medical history and physical examination, your doctor may order one or more of the following tests to help diagnose your headache. Blood tests. These can help identify any underlying medical conditions that may be causing your headache, such as an infection or a hormonal imbalance. Imaging tests. These can include X-rays, CT scans, or MRI scans. These tests can help your doctor see inside your head and look for any structural abnormalities or abnormalities in brain function that may be causing your headache. Neurological examination. This is a series of tests that can help your doctor evaluate your brain and nervous system function. These tests may include checking your reflexes, muscle strength, and coordination, as well as your ability to see, hear, and speak normally. If your doctor is unable to determine the cause of your headache after the initial evaluation, they may refer you to a specialist, such as a neurologist or headache specialist, for further evaluation and treatment. Treatment of headache. There are many ways to treat a headache, and the most effective treatment often depends on the type and severity of the headache. Here are a few common treatment options. Over-the-counter pain medication. Many people find relief from headaches by taking over-the-counter pain medications, such as acetaminophen, Tylenol, or non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, or naproxen, Aleve. There are several types of medications that can be used to treat headache, including pain relievers, over-the-counter, OTC. Pain relievers can be effective for mild to moderate headache. Triptans. These medications, such as sumatriptan, Imitrex, and rizatriptan, Maxalt, are specifically designed to treat migraines and can be taken as tablets, nasal sprays, or injectables. Non-steroidal anti-inflammatory drugs, NSAIDs. These medications, such as naproxen, Aleve, and indomethacin, Indocin, can be effective for both migraines and tension headaches. Opioids. These medications, such as codeine and oxycodone, are generally reserved for more severe headaches and may be used in combination with other medications. However, they can be addictive and should be used with caution. Combination medications. There are also several OTC headache medications that contain a combination of pain relievers and other ingredients, such as caffeine, that can help to enhance the effectiveness of the pain relief. It's important to note that the best treatment for a headache will depend on the specific type and cause of the headache. It's always a good idea to speak with a healthcare provider before taking any medication, particularly if you have any underlying medical conditions or are pregnant. Rest. Sometimes, simply resting in a quiet, dark room can help alleviate a headache. Cold or hot packs. Applying a cold or hot pack to the head may help reduce the pain of a headache. Massage. Gently massaging the neck, temples, and head may help to relieve tension and reduce the severity of a headache. Aromatherapy. Certain essential oils, such as peppermint and lavender, may help to reduce the severity of a headache when inhaled or applied to the skin. Chiropractic care. A chiropractor may be able to help alleviate the pain of a headache by adjusting the spine and neck. If you have persistent or severe headaches, it is important to see a healthcare provider for proper diagnosis and treatment. There are many alternative therapies that people use to try to treat headaches, including acupuncture. This is a traditional Chinese therapy that involves inserting thin needles into specific points on the body. Some people find that it helps to reduce the severity and frequency of their headaches. Herbal remedies. Some people find that taking certain herbs or supplements, such as butterbur, feverfew, or magnesium, can help to reduce the frequency and severity of their headaches. Relaxation techniques. Techniques such as deep breathing, meditation, and progressive muscle relaxation can help to reduce stress and tension, which may help to prevent headaches. There are many things you can try to prevent a headache. Here are a few tips. Stay hydrated by drinking plenty of water. Get regular exercise and maintain a healthy lifestyle. Eat a healthy, balanced diet. Practice good posture to reduce tension in your neck and shoulders. Avoid triggers that may cause headaches, such as bright lights, loud noises, and strong smells. Try relaxation techniques, such as deep breathing or meditation, to help reduce stress. Get enough sleep. Avoid overuse of alcohol and caffeine. Use over-the-counter pain relievers, such as ibuprofen or acetaminophen, at the first sign of a headache. If you have frequent or severe headaches, it's important to see a healthcare provider for proper diagnosis and treatment. Headaches can be caused by a variety of factors, and an untreated headache may not necessarily lead to any particular complications. However, it is generally a good idea to try to identify the cause of a headache and take steps to manage it, as chronic or recurrent headaches can interfere with daily activities and overall quality of life. Some potential complications of untreated headaches may include difficulty concentrating or completing tasks, difficulty sleeping, decreased productivity at work or school, tension or strain on personal relationships, reduced enjoyment of activities.